This module will show you how to use the Primary Care Wizard. Click the drop-down and select Primary Care. Click Apply. A dialog box appears. Click Next. Select the type of visit, new or established. Under Presenting Problems, select which applies. Under Date Reviewed Ordered, select those that apply. Management options are divided into quadrants. The top left are severe, the bottom left are mild, the two on the right are minor options. You can only make one selection. Click Next. Notice that the next screen shows a pre-selected E&M code. This is only a suggestion according to the information that you put in the previous screen. Click Complaint. Select the area the patient is complaining about. Click Next. Need signifies how many options are needed, and have are how many options you have selected. Click Location. Make your selection. Duration is how long the patient has felt this way. Quality would be where you would select how often this occurs. Severity would be the intensity of the problem. There is also a scale from 1 to 10. Under Symptoms, select the symptoms that the patient is feeling. Timing would be where you would select what time of day this is felt. Modifying would be where you would select what helps or makes the situation worse. Status is where you would make selections about how chronic this is. Click Next. This screen is present medical, family, and social history. If the physician has reviewed these already, they can click this box. If not, they can click Include. Make sure the information is correct. Under Medical History, you can select medical or surgical history. Under Social History, you would click Include. Click Next. The next screen is the review of systems. If you have already done this, you can skip this. But if this is your only mode of dictating, you would need to complete this section. Click Next when done. Add in this section any information you would like to appear in your subjective box. Click Next. The next screen is the examination. Click Vitals. Previously added vitals will appear here. Make sure the information is correct. Click Constitution. Make your selection. Go through every option and select the correct information. Click Next when done. Add any information you would like to appear in the objective box. Click Next. In this screen, you will select the diagnosis for the patient. If you know the diagnosis number, type that in. A list will appear. Make your selection. If you don't know the number, click this icon, Search, and make a selection. Once you have made your selection, click the right Add button. If you want to import all of the diagnosis codes, click this green down arrow. If you need to remove any, click one and click the left Remove button. Once done, click Next. Under Assessment and Plan, you will select what labs and diagnostic tests you are ordering, reviewing, or performing. Make your selections in each section. When you get to Consult, if you have reviewed other doctors' information with the patient, click the box. Under Interpretation, click this box if you have interpreted any labs or x-rays. History Summary is selected if old records are being or have been obtained. Click Next. Plan shows options for future plans for the patient. Make your selections. Procedures would be where you would select any procedures that have been done in the office. If a prescription has been written, the doctor can select which one was prescribed here. If any educational material was given to the patient, that would be selected here. Under Counsel, if any counsel has been given to the patient, you would select What Kind here. RTC stands for Return to Center. This is where you would select when you would like the patient back. You can also select special instructions from this box. Select Ordered Records if you have decided to request old records. Click Next. This section allows you to add any additional notes for assessment and plan. Click Next. Click Next. A dialog box appears to let you know that there is incomplete data. If you would like to go back and edit your data, click No. The sections that are in red indicates that these need to be edited or more information is needed. You would simply click the Edit button next to the one you would like to finish, make your changes, and click Next. Once all your changes have been made and you have reached this screen, click Next. The same box will appear. Click Yes. All of your information is displayed as it would be on the SOAP note. If you would like to use this E&M code for your charge procedures, you would select this box here that says Add E&M code to the charge procedures and click Save. Click OK. All of the information that you have done in the wizard will populate in their appropriate fields. Click Save. Click OK. This concludes our module of the Primary Care Wizard.